Rachel. How are you today?
Good. How are you doing?
Good. My name's Bree. I'm going to be your nurse, looking you over, performing your physical assessment. And I'm going to be talking to the camera too, that way my instructor can understand my thought process, okay? Rachel is a 20-year-old female who is a college student at Evangel University, and she's currently on summer break, isn't that right?
Mm-hmm.
Perfect. Her dress is appropriate for the weather. Her mood and affect seem to be appropriate. She's maintaining eye contact with me as I'm speaking with her, which is normal, it's to be expected. Her affect is appropriate to the situation, and as well as her dress, it's appropriate for what's outside. Looking at what skin I can see that it's consistent with her ethnicity. Her hearing seems to be intact. Talking to her, she doesn't seem to have any difficulty hearing me, and her speech is intact and clear. Which is a good indication there's no neuro issues going on or musculoskeletal issues going on in your throat, but we'll dive into that a little bit later, okay? Right now I'm going to assess your gait. I'm going to have you stand up and walk to the other side of the room. We're going to look at your posture as you're walking, which is upright and erect. Very good. Are you feeling dizzy at all?
No.
Okay. I'm going to have you sit back down. At this point, we're going to proceed with our exam, and we're going to assess your head, okay? I'm going to palpate. I want you to tell me if any of this hurts. As I'm palpating, I'm feeling for any masses or irregularities. I can see by visually inspecting that hair distribution is even and expected for, it's even and appropriate for her gender as well as her age. I can see her eyebrows. There's no crustiness or drainage. She keeps them very well kept. She appears like she has very good hygiene. At this point, we're going to assess your temporal arteries. You're going to feel me press here. Very good. We're going to assess your joint right here. I'm going to have you open your mouth and close it. Very good. Looking at her head, I can see everything on her face is symmetrical. I'm going to have you smile really big for me. And close your eyes as tight as you can. Now open them up like you're surprised. Her face is moving symmetrically, muscle-wise. Everything is even on both sides. No droopiness, or her eyelids are equal across the board. No eye drop going on. Now we're going to assess your peripheral vision. I want you to look right at my nose, and I want you to tell me when you can see my fingers wiggle.
Yeah.
Okay. All right. I'm going to take one hand. I want you to cover one of your eyes. Keep your eyes open though. I'm going to cover the same eye as you, and I want you to tell me when you can see it. Can you see my finger right now?
Mm-hmm.
I want you to tell me when you can see it.
Yeah.
Okay, perfect. Cover your other eye. I'll do it with you. Can you see my finger right now?
Mm-hmm.
Tell me when you can see it.
Yeah.
Perfect. Matches up with me. Peripheral vision matches up with me on the cover test. At this point, we're going to take a look at her external structures. I'm going to pull your eyelids down a little bit, looking at your conjunctiva, which is a light pink color on both sides. I don't see any signs of inflammation or drainage coming out of the eyes. Her sclera is white. I don't see any yellow discoloration or any hemorrhaging in the eyes. Her irises look very good, and I see no roughness over the eyes, which is a good indication of no disease. And now we're going to move on to your ears, okay? So we're going to switch this out a little bit. We're going to take a look at your external structures first. We're always visually inspecting before we do anything else. Looking at her ears, she's got a couple piercings. It looks like she's got 3 in this ear and 1 in this ear. They look non-infected, which means that you're taking care of them very well. They are even on both sides. No, one is not bigger than the other, and color of her ears is consistent with her face as well. I don't see any redness. Does it hurt at all when I touch? No? Okay. Very good. Now we're going to move on and take a look at the inside of your ears. There we go. Okay. We're going to pull up on your pinna. Take a look at your tympanic membrane, which is a pearly white color. Looks really good. We're going to do the same on this side. Assessing for any drainage or inflammation in here. Looks very, very good. Perfect. Wonderful. Now we're going to perform the whisper test. I want you to cover one of your ears. I want you to look straight ahead. Actually, close your eyes. We'll do it. And I want you to tell me what I'm saying.
Baseball.
Perfect. Well, let's cover your other ear. Close your eyes again and tell me what I'm saying.
Apple.
Perfect. At this point, we're going to look inside your nose. We're going to actually look at external structures first. Nose is straight, midline. It doesn't appear like there's any damage to the nose. I don't see any curved or deviated evidence of deviated stuff, at least from the outside. I want you to cover one side of your nose and inhale, and now cover the other side. Is it easier on one side or the other? All right, very good, which is also a good indication that there's no deviated septum. We're going to take a look at the inside of your nose now. I want you to look up. Looking at her tubernates, which is nice and moist and pink. No, it doesn't look inflamed at all. Don't see any blood or anything. Now we're going to move on to your mouth. We're going to take a look at the inside, okay? I'm going to have you stick your tongue out at me. Perfect. All right. Go ah. Uvula stays midline and moves up. All right, open. Just keep your mouth open for me. Looking at her hard and soft palate, her buccal mucosa. Lift your tongue up for me. Underneath the tongue is smooth and moist, which is to be expected. You can rest your tongue. Teeth are white. Her gums do not appear inflamed at all. Nice and pink, which means you're flossing, or at least seems to be flossing. Very good. Lips are moist, not cracked. It doesn't appear like there's any drainage coming from the lips or gums at all. We're also going to grade your tonsils. Can you open up for me? Stick your tongue out. All right. You can just. Tonsils appear to be a grade 1, which is perfect. Okay. We're going to move on and take a look at your neck. I want you to sit nice and tall for me. I'm going to just visually inspect the neck. Move your hair back. Visually inspect the neck. It appears to be midline. I don't see any masses or any growths coming from her neck. Her skin doesn't appear to have any rashes or growths, and trachea is midline. We're going to assess your lymph nodes, okay? I want you to tell me if any of this hurts. Does any of that hurt? Okay. We're going to assess your pulses. Guarded pulses are nice and strong on both sides. I'm going to come around the back, and this is easiest for me to assess your thyroid, okay? I'm going to just feel. Thyroid doesn't appear to be swollen or inflamed at all, which is very good. Okay. Did you have any pain at all when I was palpating them? Okay, very good. I'm going to have you take your ear, and I want you to try to touch your shoulder with it. Do you have any pain while you're doing that? Okay. The other side, we're just looking at the range of motion. I want you to stretch your neck all the way back and all the way forward. Do you have any problems, any pain with that? Okay. Movement is nice and smooth. I want you to do a circle all the way around. Perfect. Very good. Well, now we're going to move on to the chest, or examining your lungs and then your heart, okay? I can tell by looking at you that your shoulders are even, which is a good sign for me, that you're doing well in that regard. What we're going to do is I'm going to have you perform this test. I'm going to have this, you say 99 for me every time I move my hand on your chest, okay? I'm going to move your hair back. We're going to do this on the front and back. I want you to say 99.
99. 99. 99. 99.
Okay, I'm going to have you face that way just a little bit so I can reach your back here. Perfect. I'm going to have you do the same thing. Say 99.
99. 99. 99. 99. 99. 99.
Okay, very good, very good. We're going to pinch back here to test the expansion expansion of your chest, okay? I want to pinch a little bit right here. I want you to breathe in as deep as you can. Just got very good chest expansion. All right, so I want you to stay sitting like that. We're gonna take a listen to you, okay? Actually face me. Sorry. Big deep breath. Okay, now we're going to perform a series of tests. The whisper pictriloquy, the bronchophony, and the egophony test, okay? To perform these, I'm going to have you say 99, whisper 99, and say E. But we're going to do this in order. I'm going to listen to the front and back side of your chest while you say 99 every time I move my stethoscope, okay? As we go through, I'll tell you which one to say and how to say it, okay? Right now, I just want you to say 99 every time I move my stethoscope, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. I can hear you say the word 99. It's a little bit muffled, but that's a normal finding, okay? I'm going to have you whisper the word 99, okay? Very good. I couldn't really hear you say 99, which is a normal finding. It's to be expected. That tells me you don't have any infections in your lungs, any fluid buildup of any kind, because if there were, I would be able to hear you say 99, okay? Now I'm going to have you say E at normal, with a normal voice, okay? Every time I move my stethoscope.
E, 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 E.
Very good. Sounds good. I can hear that you're saying I can hear you're saying E. It's very muffled, but it's not as clear, which is also good. Now we're going to move on to your heart. I'm going to take a listen to all your valves in your heart. We're going to get a good pulse on you. Take a listen to your apical pulsus, which is right under here, so please pardon my reach, okay? We're going to take a listen. It may take a minute. I'm going to listen with both sides of my stethoscope, okay? I want you to breathe normal. Okay, I'm getting a pulse of about 70 beats a minute, which is good, okay? We're going to continue. I'm going to switch over, take a listen to all your valves. Sounds very good. Okay, now we're going to move on to your upper extremities, okay? I want to palpate your pulses. We're going to feel them right here. Bilaterally strong and equal. Very good. Okay, nice and strong there. We're going to check the range of motion in your shoulders and your elbows and your hands, okay? I want you to squeeze my hands as hard as you can, nice and strong on both sides. I want you to take your hands and I want you to span out your fingers as wide as you can and bring them in. We're abducting and adducting. I'm checking range of motion there. I want you to fan them out and I want to try to squeeze it nice and strong there. I want you to drop your wrist as far as you can. Perfect. Make a fist. Turn them over and I want you to pull me to you. All right, push away. Very good. I want you to pull and push. Now push out, or abducting and adducting, pull in. Okay, I want you to take your arms and I want you to bring them out as high up as you can and down. Okay, I want you to bring one arm out as far back as you can and then across your chest. Perfect, as far as you can. We're going to do the same from the other side. Very good. I want you to take one arm, I want you to scratch your neck. And now I want you to try to reach for your other shoulder blade behind your back. And do the same thing over here. Any difficulty with that? Any soreness? Okay, very good. I can see that hair distribution in our arms is nice and even on both sides. Colors consistent with ethnicity, you know, signs of rashes or growths of any kind, which is very good. All right, Rachel, now we're going to take a look at your abdomen. I'm going to have you lay down for me, okay? We'll keep you nice and covered. Okay. Alright, we're going to pull up your shirt. Okay, so I'm going to have your hands to your sides. Pull up your shirt. We're just going to look at your belly, your abdomen. Upon inspection of her abdomen, I can see that the contour of the abdomen is symmetrical throughout. I don't see any rashes, hair growing in abnormal places. I don't see any obvious masses. It doesn't appear like there's any lesions anywhere. Are you having any abdominal pain at all?
No.
Okay, very good. I am going to first take a listen to your belly, okay? I'll try not to make this cold, but I just want you to try to relax for me. I can also see by visually inspecting the abdomen, the pulsation in your belly, which is to be expected, okay? I'm going to lightly touch. I want you to tell me if there's any pain or tenderness. Anything anywhere?
Nope.
Okay. I'm going to press a little bit harder, feeling some of the structures in your belly, okay? Just tell me if you have any pain anywhere. Okay. Very good. We're going to try to feel your liver, okay? Trying to feel the border of your liver. Which I can feel. And trying to feel your spleen too. I don't feel your spleen, which is good. You're not supposed to normally feel it. Very good. Okay. Move into your other side. Sorry, my hands are cold. Trying to feel your kidneys and I can't. Okay. Alright, Rachel, now we're going to take a look at some of your joints, okay? I'm going to have you take your knee. I want you to push it out there, just like this, and down. Same thing on your other leg. We're going to bring it up as high as we can and pull it back as far as you can. Okay, perfect. Now we're going to have you pull your ankle toward your toes to your nose and push down as far as you can. Now make a circle with your toes, same thing over here, up and down. Now make a circle. Range of motion in her knees and ankles appear to be normal. We're actually gonna have you lay down again, okay? I want you to lift, we're going to have you lift your leg up. Just tell me if any of this is hurting. I'm going to do the same thing over here. All right. I'm going to have you abduct your hips and then adduct, cross over. Perfect. So we're going to do the same thing over here. Abduct, adduct. Very good. Any pain right there? Okay. No pain pressing there? Okay, perfect. I'm going to have you flip on your belly. Have you extend your legs. I'm going to have you pull one up. Very good. And now the other. Any pain in your hip doing that? All right, perfect. Okay, at this point we're going to do the musculoskeletal portion of the exam. I'm going to uncover your legs. We're going to go take the sheet up to your waist, okay? On visual inspection, I can see that her legs are about the same size. They appear to be symmetrical in size. I don't see any evidence of edema or varicose veins by just looking at them. Temperature is normal. Skin color is consistent throughout the legs and is consistent with her ethnicity. Hair distribution appears to be pretty good for a female. She shaves her legs, so I don't really see much hair on her legs. See a little bit here on the toes, which is to be expected. At this point, I'm going to cover you back up. We're going to assess your pulses in your legs, and all the while, I'm going to be assessing for any evidence of edema. So I'm going to have you bend your knee, Rachel, okay? Just relax it. We're going to assess your pulses behind your legs. Okay, nice and strong. And come to your other side. We're going to uncover this leg too. Alright, bend your knee. I want you to just relax your leg right here. Alright, perfect. Alright, I'm going to assess your pulses down here. Your posterior tibial pulses. Bilaterally equal, now your dorsalis pedis pulses. Which are both equal and strong. Okay. At this point, I'll have you go back and we'll let you put your pants back on, okay? I want you to stand up, and I want you to close your eyes for about 20 seconds. It's the Romberg test. We're going to see if you can maintain your balance even with your eyes closed. Very good. All right, I'm going to have you turn around for me. We're going to assess your spine. See, we're going to palpate a little bit. I'm going to find your C7 here. Kind of just feel your spine, your vertebra in your spine. Sorry if that tickled a little bit. All right, I want you to bend forward for me. I'm going to take a look at your spine. Oh, keep bending. Try to touch you. What I want you to do is take your hands. I want you to just try to touch your toes there. Now look at the curvature of your spine, seeing that it's midline or staying straight. And then it appears to be doing so. Very good. You can stand up. All right, I'm going to have you, what I want you to do, we're going to test your range of motion while you're standing. I want you to extend as much as you can. We already had you bend forward. All right. Up, and I want you to bend your whole spine from side to side. See that we have good range of motion there. And now I want you to twist. I want you to twist like this and like this. Perfect. Very good. Very good. All right, let's turn around and have you sit down. Okay. All right, now what I want you to do is I want you to take your palms and I want to have you, as fast as you can, flip up and down with your palms. Very good. Movement is nice and smooth and symmetrical on both sides. It doesn't appear like there's any delay on one side or the other. Now I want you to take your finger on one of your hands. I want you to touch your nose. Touch my finger. Touch your nose. Touch my finger. And we're just going to go back and forth. So a taxi present in that extremity. How about this one? Back and forth. Very good. Movement is nice and smooth, no ataxia, no difficulty getting to her nose or my finger. All right, Rachel, now I want you to take one of your heels and I want you to run it up and down your shin. Very good. We're looking for ataxia as well. I want you to do it with your other one. Perfect. It doesn't appear like there's any ataxia or any motor issues. Now, I want you to close your eyes for me, okay? At this point, I am going to take an object and I want you to tell me if you feel 2 points of contact or just 1, okay?
1. 1. 1. 1. 1. 1. 2. 1. 1. 1. 1. 2.
Okay, very good. Keep your eyes closed. We're going to do the same thing on your legs. I'm actually going to pull up your pant legs just a little bit to do this. All right, same thing. I want you to tell me if you feel 1 or 2.
1. 1. 1. 2.
Very good.
1. 2.
Very good. Okay. Keep your eyes closed. I want you to tell me if it's a sharp object or a dull object. And then I want you also to tell me where I'm touching you.
On my cheek, and it's dull.
Okay. Was it your right or your left cheek?
No.
Okay. Same thing over here.
Right cheek and dull.
Okay. Again.
Left arm sharp. Right hand sharp. Left ankle and dull. Right foot sharp.
Very good. Very, very good. Okay. At this point, we're going to test your reflexes. Oh, you can open your eyes, sorry. At this point, we're going to test your reflexes, okay? Just let me know if this hurts. Very good. Reflexes are intact so far. Very good. All right, we're going to take your shoe off here for a second. We're going to look at your Babinski reflex, okay? Okay, we'll ticklish for that one. All right, you can put your shoes back on again. All right, well that concludes our exam. Do you have any questions for me?
No, ma'am.
Okay, all right, thank you very much.
Thank you.